Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. Today we're going to do a tiny bit of myth busting, or at least I want to make a clarification on something that is commonly talked about, which is the somewhat inevitable decline in testosterone levels that occur with aging. That there seems to be this notion that there is an inevitable decline in testosterone levels as we age, and that there really isn't much that we can do about it. And there is some element of truth to that. Most of the studies show maybe 0.5% to a 1% decline in testosterone starting perhaps somewhere in the 20s. That goes down every year. But many men decline much more rapidly than that, which makes you wonder that maybe there's some other factors at play other than just aging. And I strongly believe that there are. I believe that the epidemic of hypogonadism that we're seeing in middle-aged men now is not a inevitable byproduct of the aging process, but rather it's the accumulation of one or more, usually more than one, comorbidities that lead to low testosterone hypogonadism at epidemic rates that we're seeing. So as you guys know, it's well documented testosterone levels in all age groups have been declining now for decades. This is a paper that I've cited before. It's a decline in serum testosterone levels among adolescent and young men in the United States. This is the 2020 European Association of Urology journal, and it's quite clear that levels are declining. This is a chart from that journal, which shows a fairly impressive graph here. The reason I like this study so much is not only that it goes back over 2 decades, but it looks at very young men. It looks at teenagers. So they had a cohort in the 15 to 19 age group that they looked at multiple time points, and not surprisingly, they had the same relative decline, as you can see with these straight arrows here, or these straight lines over time, that they are also suffering a steady decline. And even when corrected for obesity, which is a major factor here, even when you correct for obesity, there is still a decline in all of these age groups. So there's something even more than just the accumulation of body fat in these young men that's leading to this decline in testosterone. That's another talk. And I think I've covered that pretty adequately in the past. I think it's likely a multitude of different things, not the least of which is exposure to endocrine disrupting compounds. So this is a really interesting pie chart here, and it's from this article from the Mayo Clinic Proceedings, Adult Onset Hypogonadism. It's quite good. It's from July 2016, and on the right here, I want you to focus on the brown part of this pie chart here, and this is 89% is the number of men that are in this particular study that were diagnosed with secondary hypogonadism. Remember, there's secondary and primary. Primary hypogonadism is essentially testicular failure. So the factory is closed. No matter what you do, you can't coax the lights to come back on. Secondary hypogonadism is generally a problem in the hypothalamus or pituitary gland, leading to suboptimal or low levels of LH and FSH, and it is by far the most common cause, at least today, for hypogonadism worldwide. So, and I've mentioned this before, but again, if you receive a diagnosis of hypogonadism or suboptimal testosterone from your physician, make sure that they do a workup to differentiate between those two, because it's pretty important. It will have ramifications in terms of what your protocol for treatment is going to look like, and there are hidden in there some very potentially serious, even life-threatening underlying medical conditions that could be manifesting as hypogonadism. So you want to make sure that your physician is qualified and has done a thorough workup to make sure that you don't have one of those conditions. Just because you have a low testosterone level doesn't mean you walk out the door with a prescription for testosterone that day. At least it shouldn't, even though unfortunately I see that quite a bit. So the point of this article that I want to hone in on that was really good is they took a closer look at this 89%. And they took a closer look at them. They were like, okay, well, they don't have an identifiable medical disease state per se that directly is causing their low testosterone, but maybe they've got something else going on. Maybe there's something metabolically here. Maybe they have a number of other comorbidities. Let's see what's associated with their condition, which is secondary hypogonadism. And it turns out that over 70% of them, not surprisingly, either met the definition for clinical obesity, they were full-blown type 2 diabetics, or they had metabolic syndrome. So these guys were obese. They had problems with insulin, and then all of us who are involved in the treatment of men with low testosterone levels, this is what we see every single day. It's typically guys who have excessive amounts of body fat. This directly influences the hypothalamus, primarily through the oversecretion of unfavorable adipokines and even hypothalamic inflammation, which suppresses an appropriate LH and FSH response in the patient. So obesity, type 2 diabetes, metabolic syndrome, all of these you can sort of tie together. They're not really different problems. They're all closely related. This is the root cause for many men. But there's more. There's more to this. And I want to talk about this study right here. It's called the Association of Cardiorespiratory Fitness, Body Mass Index, and Age with Testosterone Levels at this Cooper Center longitudinal study. So this was published in the 2018 issue, September, I believe, of the journal Maturitas, which I hadn't heard of, but it's the official journal of the European Menopause and Andropause Society. So it's actually a pretty well-respected journal. It's the first time I came across it, so I'm going to keep an eye on that journal. But this chart here is very telling. So they looked at a really large group of men, almost 2,000 actually, between the ages of 50 and 79. And they looked at their body mass index, and they looked at their cardiorespiratory fitness as measured by their ability to perform exercise at various MET levels, or metabolic equivalents. And I'll tell you about that in just a second. And not surprisingly, we know that BMI was clearly associated with lower testosterone levels. That shouldn't be a surprise to anybody. But what may come as a surprise to some people is that cardiorespiratory fitness was a major predictor of whether men, as they get older, were going to be able to maintain normal testosterone levels. It actually had a really huge impact. So I highlighted a couple things that I want to point out to you here. If you look in the first vertical chart here, so this is what they defined as objectively low testosterone was less than 250 nanograms per deciliter total testosterone. And if you look down here under cardiorespiratory fitness, in parentheses METs, if you were in the top quintile, which is the top 20% of men in this group in terms of cardiorespiratory fitness, only 5.4% of them had this objectively low testosterone at less than 250 nanograms per deciliter. If you were in the bottom 20% for cardiorespiratory fitness, so it was 21% of those men had objectively low testosterone. And then if you look at this unfit group here, I mean, as you move to the right, 41.5% of them had a level between 250 and 399, which they defined as low normal. But I think all of us, can appreciate that certainly may not be optimal for these men's health, and certainly low enough to potentially be symptomatic for them. And then, the reverse is true here with this high quintile group. Again, 5.4% less than 250, but 69% of them were above the 400 nanogram per deciliter threshold, which they defined as objectively normal. So there's a clear relationship here between age, not only obesity, of course, but physical fitness and testosterone levels. And so, this begs the question, as we get older, many men think, and they assume, I think incorrectly, that, well, eventually I'm going to have to get on TRT. I'm just going to, it's just what happens, the way things are these days. I'll probably be in my early to mid 40s, and, my levels will drop, and I'm going to eventually have to get on testosterone therapy. And that is not necessarily the case. And so I want to talk about that a little bit more here. Before I do that, though, this chart is important just for clarification. So they talk about METs, okay, which is short for metabolic equivalents. And I think the best way to think about METs, it's based upon how much oxygen the body consumes at a certain level of activity versus how much it consumes at rest. And you can assign a number to that, and it involves calorie consumption. There's an equation for it. I'm not going to get into all of that, but I just want you to look at the chart here. So down at the bottom, so if you can do yoga, and I don't know, I think this must be like old lady restorative yoga. This is 2.5 mets, which is pretty damn close to resting. And then as you move upward, like a really vigorous racquetball game, if you could play racquetball at a pretty vigorous clip, that's about 7 mets. Playing golf or walking for exercise, that's right around 5 mets. But competitive cycling, so I presumably, maybe not quite Tour de France level competitive cycling, but right up there, or cross-country ski racing, greater than 8 miles per hour, that's like 15 or 16 mets. So that's very, very tough. Very, very tough. Running a 10-minute mile is close to 10 mets. So just to give you an idea of what each of those numbers represents, because it's going to be important to understand that when I show you these graphs here, which I think are pretty cool. Now these are like 3-dimensional graphs here, so they can look a little daunting and confusing. So if you need to pause the video to kind of assimilate this stuff, feel free to do that, because these are not normal like XY axis. There's a third axis, X, Y, and Z here. But what I want to point out here, this first one here on the left here, mean testosterone levels as plotted via age and fitness. So let's look at the age in years. So we start here with 50 and we work our way up to 80. Okay, and then we can look and see what happens with testosterone levels. The interesting thing about this chart is as you move to the right above, along the fitness axis there with mets, it's like going up a set of stairs. At every met level that you go up, every 5 mets basically, you get a corresponding increase in testosterone levels. So, and that's why it really, like, especially for the age 50 group, it looks just literally like you're walking upstairs. And they have more data points for the guys that were 50. There were not very many 79-year-olds in this study as compared to 50-year-olds. So that's why it looks a little bit incomplete. But this says a lot here. If you're a 50-year-old guy who could exercise at close to 15 mets, I mean, most of those guys, their average testosterone level was right up around above 600, which really isn't too bad for a completely natural 50-year-old. Now the interesting thing is they didn't have any data points for 80 and basically above 60 to 80-year-olds. There weren't any of them that could do 15 mets. That's quite a lot to ask. But look, if you were 60 and older and you could do 10 mets of activity, which is pretty intense. I know a lot of 20-year-olds that can't do 10 mets of activity. But if you were in that 60 to 79 or 60 to 80 group and you could perform physical fitness at 10 mets, I mean, most of those guys, their mean testosterone level was at least above 500, which is still, that's not bad. And again, for many men, maybe not all, but for many men, because this is a highly individual and genetic thing based on the sensitivity of your androgen receptor and a number of other factors, that may be more than enough to maintain optimal metabolic health and to keep you free of symptoms of hypogonadism. It may be, okay? Over here on the right, it's, so on the first graph, we see it looks like you're walking up the stairs, right? The more fit you get, the higher the average testosterone. Well, this chart shows the fatter you get, it's like going down the stairs, okay? So if you have a BMI of around 20, which is pretty thin. I wish, again, I don't want to beat a dead horse. I don't like BMI. I wish we could have these studies done in terms of body fat percentage, because I think it would be a lot more useful. But BMI is what researchers like to use. I think we're stuck with it, for the foreseeable future. But basically, as your BMI goes up, regardless of age, this applied to 50-year-olds and this applied to the older guys up into their 70s and almost 80. As BMI went up, testosterone levels go down. And that's exactly what we would expect. And that shouldn't come as any surprise to any of you guys. And then here, this is a final chart here. looking at the number of men percentage-wise that had objectively low testosterone. I kind of touched on this before, but less than 250 nanograms per deciliter. Again, also kind of like as you move forward, kind of like going down the stairs. So if you had very low fitness levels, like if you could only do 5 METs, which again is walking for exercise, is what they called it. I do not think, first of all, walking is not exercise, it's transportation. It doesn't count in my opinion. Certainly if you're under the age of 50. Now, if you're 90 years old, going for a walk, that might be the most that you can do. I'll let you count that as exercise. But most of you guys, I don't think, are 90 years old. So I don't want to digress too much on that. But again, the more fit that you become as you move forward on this graph, as your METs go up, the probability of you having an objectively low testosterone level just goes straight down, straight down. And you can see at the 15 MET level, there's basically like, there might have been one guy that had a testosterone level less than 250 nanograms per deciliter. I'm not going to pull up all the chart data, but based off of this, it's pretty flat there. There's basically nobody that had a testosterone level under 250 if they were able to perform 15 METs of exercise, which again, pretty intense. This is like competitive cycling, that sort of thing. So this is I think this is a really cool study. So I'm going to read off some of the conclusions that they came to. They said, in conclusion, this cross-sectional study does not support the contention that testosterone decreases uniformly with aging in healthy middle-aged to elderly men. Yeah. In fact, it was more correlated in here with increasing BMI, and it was more correlated. Low testosterone was correlated with poor cardiorespiratory fitness. So the fatter you get and the more out of shape you get, the more likely you are to have low testosterone as you get older. They go on here and they say, finding similar testosterone levels across decades of age suggests that lower testosterone is not an inevitable consequence of aging. Testosterone levels were inversely associated with BMI and positively associated with fitness, as I just mentioned, okay? So it's not a done deal. Just because you're getting older does not necessarily mean that you are going to end up on TRT. Now, if you, as you get older, stop exercising, if you let your diet slip and you start gaining weight and you start getting out of shape, you may end up in that hypogonadal group. I mean, this study would suggest that that's what's likely going to happen to you. And certainly if you develop obesity, type 2 diabetes, metabolic syndrome, you are well on your way to a diagnosis of hypogonadism, according to all the data that we have, at this point. So it is extremely important in an ideal world, none of us would need to be on testosterone replacement therapy. And if you want to stay off of testosterone therapy, which I think should be your goal, okay, this is a doctor who does prescribe testosterone to men. I would rather not have to prescribe you testosterone. And right now, there's 2 bits of advice that I can give you if you want to delay that as long as possible or if you want to avoid it entirely. And that is, do not become obese, okay? And in terms of body fat percentage, I think, this is my personal opinion, but it is supported by data, a body fat percentage of somewhere between 10 and 15%, which very few men today have. It was very common 100 years ago. It's not very common today. So 10 to 15% body fat. And then equally as important, you have to maintain a very high level of cardiorespiratory fitness. Imagine these guys, the 60 and 70 year olds in here, the few of them that could perform exercise at 15 METs. Imagine what you have to do for the preceding 40 years to be able to do 15 METs of exercise at age 65. All right, you have to be a stud, and you have to start young, and you have to work and work and work. You have to be very disciplined. You have to put in these hard. You don't skip workouts, and you have to maintain. Those guys didn't just wake up at 50, fat and out of shape, and decide that they're going to get their lives together and end up being able to do 15 METs worth of exercise at age 65. Very unlikely. Okay, these were probably lifelong athletes. These were probably folks that in their teens and early 20s were exercising and possibly competing even in certain sports at a very high level. And then as they got older, they maintained their workouts. And that's that's what you have to do. I know that some of you guys are already in your 50s and can barely do 5 METs, okay? So it may not be realistic that you'll ever be able to do 15 METs of exercise, but it's not impossible. You know, if you put your mind to it, there's a good chance, you know, maybe you can. But it's very difficult to do that. So those of you in my audience that are young, you guys that are in your early 20s, I know there's a small number of you that have reached out to me. Listen, you got to get on it. You have got to get on it. You need to get your body fat down into the low teens, and you need to get your cardiorespiratory fitness as jacked up as high as possible. I like to do that with high intensity resistance training and high intensity cardio. Like I like to do sprint intervals on the bike. I like to do sprint intervals on the, there's a rotating like stair climbing machine at my gym. And I will crank that sucker up, and I'll get my heart rate as high as it can go. I'll get it close to my maximum heart rate, and I'll maintain it there for 2 to 3 minutes. I'll come back down again, let my heart rate recover a little bit, and then I'll blast it again. I'll do that 5 or 6 times. It's absolutely brutal. It sucks, and I'm not gonna lie. When I'm in it, I hate it, but I feel amazing afterwards. And that's what you need to start doing in your 20s. If you want to be one of these studly men who at age 65 or even 70 are running around with greater than 600 serum testosterone levels. The very few guys that I've seen over the years that are you know, above 60, we'll say, that have come in to see me to have their levels checked, that had, and I have seen a handful of them, like 657, even 800 testosterone, you know, total testosterone levels. All of those guys were extraordinarily fit. Like they were really fit guys. There was not a single one of them that was a slob. So, you know, there's a reason why their body fat, or there's a reason why their testosterone levels were that high, is because they had been fit for their entire adult life, and honestly probably into childhood too. So it can be done, guys. It's hard work. You just have to stay disciplined. You have to have an action plan. Aging is like a marathon. It is. You have to have a plan. You have to start early, and there's different phases. There's things you're going to do at the beginning of a marathon that maybe you're not going to do at the middle and towards the end. But you need to do things in the beginning and the middle, anticipating how you're going to feel and how you're going to be towards the end. Right? You're not going to feel the same in that last mile as you do during the first mile. So again, you have to take a lifelong approach to healthy aging, and please, you know, start early. If you're in your 20s, you know, reach out to me if you don't know what to do. I'll be happy to give you a little bit of guidance. All right, guys, that's all I have for you today. Just want to touch on that myth. It's not inevitable that you need to be on testosterone therapy, despite what you hear in the media, on the bro forums, and from some of these TRT clinics. There's a way to avoid testosterone therapy. It's just going to require a lot of work, a lot of discipline on your part. Okay. All right, guys. As always, I love to hear from you guys. Feel free to reach out, ask questions, and I will catch you all next time. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.